Hero FinCorp presents Young Turks, 14 years.
What is really happening right now, the baseline of the shift is consumer centricity, right? So if you look at the 300 healthcare startups that came up in this country over the last 2-3 years, everything is related to what the consumer wants, right? And our traditional healthcare systems have all revolved around what the clinician wanted, what we all set up as healthcare infrastructure. So you set up a hospital and patients will come. I think there is a huge consumer drive which is happening in healthcare in this country, and that's one of the biggest shifts that we are seeing. And, so healthcare consumerism is the one which is going to define all these platforms.
Sure.
So, whether it's connect with the doctors, connect with enterprises, whatever it is, we are all going directly to the customer and saying, you want better healthcare, we'll deliver it for you.
So, how is this shift changing the whole dynamics of the sector?
I think, the way that I see it, I'm seeing that shift happen on the hospital side of things. So, you can put this into 2 or 3 different buckets. I think on the hospital side of things, we're already seeing the shift happening in terms of more and more asset-light models getting created. Yeah. More and more single specialty hospitals coming up. And you see them all over the place, right? And more you find out of the multi-specialty, large format institutions, specialties are beginning to move out, right? And what will remain at the core of the large format, multi-specialty hospitals are those very intensive surgical procedures which you can't do in the small format healthcare institutions. So I think that's one big shift which is already beginning to happen.
There was a time where I used to only say that doctor is my customer and I have to focus all my energy after doctors. That is very quickly changing, and I see some of my centers where if I go through test equation form, doctors have never prescribed you have to go to Metropolis. It is patient who made the decision, and that is a big shift. So I have to gear my all services, energy and infrastructure which is patient friendly and which is liked by patients. So that is one shift I'm seeing. I also see patient becoming more aware about the test. I also see demands now increasing from patient as well as doctor. Today, if I just talk about medicine part, it's time gone where I just give a diagnostic test. Time has come where I graduate to personalized medicine kind of a thing.
There are 3 words which are very important, which were not existing in my college days. One is IT, the second is logistics, the third is HR.
All right.
These 3 are going to dictate. IT will dictate, logistics will facilitate, and HR will execute. Government neither has IT nor has logistics nor has HR. So guys who are sitting here, please remember, you don't have to do great things. You have to only focus on customer acquisition, if I am not wrong in business terms. India has got not less than 10 crore diabetic patients who don't know that they are diabetic.
Exactly, yeah.
And 70% of the hospital revenues are simply because of one disease, diabetes. So, there is nothing you need to fantasize. And let me give you what I always tell in TiECON. If you want to become a billionaire, you have to do an SBADMK. Don't think I have come from Chennai with some agenda of ADMK. SB means Sida Baito. AD means Apna Dekho. MK is Mehnat Karo.
Doctor, we need to come up with a model. So any of you would like to give suggestions on how the government and the private sector can work together and make it really happen?
Where the government can play a huge enablement role is, number one, we still spend 1%, 1.2% of our GDP on health. We have to improve the government spending on healthcare and double it up, at least to about 2 to 2.5%. That itself is a huge enablement process. Sure. I think the entire education reform, the medical and the paramedical education reform, that's the only agenda, if the government follows it well, it can create a huge enablement process. I think if we just get our medical education system souped up and ramped up, and we can produce more number of doctors and nurses and paramedical staff in this country, we are halfway home. If that doesn't happen, then we will all be doing disruption of creating these consumer connect models.
Yeah.
Because fundamentally, what are we trying to do? We are trying to optimize on all resources that are sitting out there and trying to maximize them.
Yes.
That's it.
Yes, yes, Doctor.
If I talk about public-private partnerships, where Dr. Velumani made a point, that every time something like that comes up, it is completely non-standardized. It is not that central government has any role. Every state decides on their own. And though we call as public-private partnership, there is nothing like partnership. The things which are put are so impractical. They don't check on feasibility. They don't check on economic viability. It is all the burden transferred. And most of the time you don't feel like applying. So in a good partnership, I think they have to see this feasibility and viability part and then float such tenders. And the transparency part is quite missing there. So this is what I would, in short, if I have to tell you, I would look from government.
Sure. All right. So with that, we've come to the end of this panel discussion. Thank you, audience. Thank you, panelists. It was a pleasure speaking to you.
Thank you very much.
Hero FinCorp presents Young Turks 14 Years.